My name's Navo.
Hi, my name is Jung Nguyen.
My name's Vương.
Hi, my name is Min.
I think the ultimate goal in the Vietnam Health Project is to spread awareness about the poverty in Vietnam and to build a community that cares and tries to make a positive impact in their lives.
I feel like even with the development in Vietnam and how it is now, we could always use help. That's where VHP comes in. We try to help.
Apply for the Wisconsin Idea Fellowship grant through the Morgridge Center, and they actually help fund us to work with this landfill community. It consists of about 100 families. They live and work directly on the landfills, and so with that living environment, it's really detrimental to their health. So we wanted to ameliorate that living condition.
We did a couple of things in the Yak Ya community. First, we met with the children in the landfills and taught them about basic hygiene, like brushing their teeth and washing their hands. We also taught them about the human anatomy by drawing a big picture, big chalk man, and having them run to like body parts. We also we broke up the group into like older kids, and we taught them about human development and sexual development and like safe sex. We gave out food like rice and cooking oil and soy sauce to the families. And we also met 2 students that we sent to vocational school so they can, we sent a student to learn how to fix motorcycles so that they can come back and teach their community so they can get out of the cycle of poverty that they're in.
We also visited hospitals and donated medical supplies to them, and we did doctor shadowing to learn more about the medical system in Vietnam. And finally, we visited orphanages to donate food and the toys, books for the kids and play with them.
We work with the Callus Foundation. That's another organization that worked directly with these community members. They built a school to teach these children specifically because majority of the kids are illiterate. They don't even have a chance to go to school, like to a normal public school. And so working with them, we realized that even with teachers available to teach the kids, they couldn't go to school because they get sick from drinking non-potable water. And so to work with that, we actually bought water filters. It's called Life Straw. It's just a straw. As you suck up the water, it filters out the virus and bacteria. It's really convenient because the kids can just put it around their neck, so they can just bring it wherever they go, and if there's a source of water, then they would be able to get clean water. And I mean, like, it seems so simple, like brushing your teeth every morning or before you go to sleep, or washing your hands before you eat. But these kids they're not exposed to that kind of knowledge, and so a lot of them, it was their first time brushing their teeth. And some of the kids that I worked with, one of them only had like 1 tooth left on the upper jaw, and it's really sad, I think, to see that. When we all visited the landfill, and like the kids would pull us in and be like, "Come visit my house" and stuff like that, and I would go in, and when you say visit my house, you would imagine at least like a little house or something. It's literally like a shack built with whatever they found on the garbage dump. And it really shocked me to see the living condition because it was really stinky. The first 5 seconds I was there, I started gagging and I had to run back out, otherwise I would have puked.
I am from Vietnam, and even I feel surprised when I went on the trip and observed the condition there. They live on landfill, and so that's where they live, where they eat, where they do everything, and where they work too. They don't have house or anything, they just live on it 24/7, and the water is dirty, the environment is unhealthy, and they live there generation to generation.
I came from Vietnam. I am Vietnamese American, and I know that not everyone was as fortunate as me to come here to the United States, because even when I was 3, I remember how impoverished the land was.
Their priority really is just it's basic survival, being able to buy like meals every day, bringing food to the table, having a place to live, and that's on the landfill. We had to provide the children with lunches during lunchtime. While we were passing out the lunch, one of the things me and Hoan came across was two 4- or 5-year-old kids holding on to their lunch, and they were like really protective over it. I asked, have you eaten? Like, why aren't you eating? Being 4- or 5-year-olds, I was just like, okay, do you need help? I can help you. And they're like, no, I want to save it to bring home for my parents to eat later. Is it okay if I leave now? And 4-year-olds asking me to, permission to save their lunch, their food, to bring home to their family. It broke my heart to see that a child that young was able to, think for others, think for their family instead of themselves.
I'm really surprised that even though they live in a very bad condition, they still very happy, and the little kids, they play and have fun with each other just like everyone else in the world, and they feel like they are just like everyone else. When I came back and visited them, they actually improved their health, living condition, and they still do what we taught them. I'm really surprised how much it meant to them when we taught them, because they actually use it in their life.
We saw that a little boy had an infection in his arm, and then we took him to the hospital right away, and we waited for 3 hours until we could see a doctor, and then the doctor was able to perform on his arm before he has to get it amputated, and that money came straight from our own fundraising pocket, and it really made a difference in his life.
For me, the one thing that I like most about the Vietnam Health Project is the relationships I've made with the members, and just knowing that my time with the group and my volunteering of my time is going towards a good cause. And it's just really rewarding to know that your time that you're putting in selling ice cream is going to go towards a kid that really needs it in Vietnam.
Do it for the kids, do it for the betterment of the lives of the people in Vietnam. If you think about it, we volunteer 8 hours, so we get 10% of the proceeds. We make usually, for a football game, it's $4,000, so it's $400 that could really benefit a family in need, and it could even save a family member's life.
Get involved because you'll have like a great opportunity to work with great people that will inspire you. You'll be able to have an experience that will definitely change your life, because it definitely changed mine.